Welcome back to the Nurses Study Partner. This is Tetanus, Part 2, Management, Nursing Care and Prevention in 10 in-depth scenarios. We'll cover wound debridement, neutralizing the toxin with immunoglobulin, antibiotics, controlling spasms, the quiet nursing environment, autonomic care, why survivors still need vaccinating, the toxoid vaccine, wound prophylaxis decisions, and preventing neonatal tetanus. Read each case, weigh all 4 options, pause to choose, then check your reasoning. Let's begin. Question 1. A patient with tetanus has a deep wound containing dead tissue, dirt, and a small foreign body. Which wound management is most appropriate? Option A. Cover the wound tightly and leave the debris untouched. Option B. Apply a thick airtight dressing to seal in the wound. Option C. Thorough cleaning and debridement of the wound. Option D. Do nothing to the wound. It plays no part in tetanus. Pause here and choose your answer. The answer is C. Thorough cleaning and debridement of the wound. Removing dead tissue, dirt, and foreign bodies eliminates the anaerobic environment the bacteria need and removes the source of toxin production. An airtight dressing would worsen the anaerobic conditions, and ignoring the wound leaves the toxin factory in place. Wound care is a key pillar of treatment. Question 2. The team wants to neutralize tetanus toxin that has been produced but has not yet bound to nerve endings. Which treatment achieves this? Option A. Human tetanus immunoglobulin or antitoxin given early. Option B. A simple painkiller such as paracetamol by mouth. Option C. A high sugar drink to boost the patient's energy. Option D. Waiting since the toxin clears completely on its own. Pause here and choose your answer. The answer is A. Human tetanus immunoglobulin or antitoxin given early. It neutralizes circulating toxin that has not yet bound to nerve endings, limiting further spasms. Importantly, it cannot reverse toxin already bound. That damage must recover with time, which is why early administration matters. A painkiller, a sugary drink, or waiting will not neutralize the toxin. Question 3. Alongside antitoxin and wound care, the team wants to kill the Clostridium tetani bacteria still in the wound. Which antibiotic is the usual first-line choice? Option A. No antibiotic is ever needed in tetanus at any stage. Option B. Metronidazole, an alternative being penicillin. Option C. A topical antifungal cream applied to the skin only. Option D. A single dose of an antiviral tablet taken once. Pause here and choose your answer. The answer is B. Metronidazole, with penicillin as an alternative. Metronidazole is the usual first-line antibiotic for tetanus, given to kill the C. tetani bacteria in the wound and stop further toxin production. Antibiotics complement but don't replace antitoxin, wound debridement, and spasm control. An antifungal or antiviral would be useless, and antibiotics are indeed needed. Question 4. A patient with tetanus is having frequent, severe, painful muscle spasms. Which is the mainstay of controlling the spasms? Option A. A strong stimulant drug to keep the patient wide awake. Option B. bright lights and loud music to distract from the pain. Option C, vigorous physiotherapy stretching during each spasm. Option D, benzodiazepines such as diazepam, magnesium if needed. Pause here and choose your answer. The answer is D, benzodiazepines such as diazepam with magnesium if needed. Benzodiazepines are the mainstay for controlling spasms. They give sedation and muscle relaxation by enhancing GABA. Magnesium sulfate helps control spasms and autonomic instability. In severe cases, patients may need neuromuscular blockade with mechanical ventilation in intensive care. Stimulants, bright or loud stimuli, or vigorous physiotherapy would all worsen the spasms. Question 5. A nurse is setting up the care environment for a patient with tetanus whose spasms are triggered by noise, light, and touch. Which environment is most appropriate? Option A, a busy, brightly lit bay near the noisy nurse's station. Option B, frequent loud check-ins and bright overhead lighting. Option C, a quiet, calm, dimly lit room, minimal handling. Option D, regular loud alarms to keep the patient fully alert. Pause here and choose your answer. The answer is C, a quiet, calm, dimly lit room with minimal handling. Because external stimuli, noise, light, and touch trigger painful spasms, the patient should be nursed in a quiet, calm, dimly lit room with minimal handling and clustered, gentle care. This reduces spasm frequency and distress. A busy, bright bay, loud check-ins, or alarms would provoke more spasms. Question 6. A patient with severe tetanus develops swinging blood pressure, a racing, then slowing heart rate, profuse sweating, and fever, reflecting autonomic instability. Which is the most appropriate approach? Option A, close monitoring in ICU, magnesium and supportive control. Option B, ignore the vital signs as they never matter in tetanus. Option C, send the patient home to recover quietly by himself. Option D, stop all monitoring to avoid disturbing the patient. Pause here and choose your answer. The answer is A, close monitoring in ICU with magnesium and supportive control. Severe tetanus causes autonomic instability, labile blood pressure, arrhythmias, sweating, and fever, which can be life-threatening. It needs close monitoring, ideally in intensive care, with magnesium sulfate and agents such as beta blockers to control it alongside sedation. Ignoring the vital signs, discharge, or stopping monitoring would be dangerous. Question 7. A patient is recovering from tetanus. He assumes that having survived the disease, he is now immune and needs no vaccination. Which statement is correct? Option A, correct. Surviving tetanus gives strong lifelong immunity. Option B, he can never be given the tetanus vaccine after illness. Option C, vaccination is pointless because the disease is untreatable. Option D, tetanus gives no immunity. He still needs the toxoid vaccine. Pause here and choose your answer. The answer is D. Tetanus gives no immunity, so he still needs the toxoid vaccine. A crucial point. Surviving tetanus does not confer immunity because the amount of toxin causing the disease is too small to produce a protective antibody response. So the patient must still receive the tetanus toxoid vaccine, a full course, to be protected in future. It is not lifelong immunity, the vaccine is not withheld, and vaccination is very worthwhile. Question 8. A community nurse is explaining how tetanus is prevented in the population from childhood onwards. Which is the cornerstone of prevention? Option A, avoiding all outdoor activity and never touching soil. Option B, tetanus toxoid vaccination, primary course plus boosters. Option C, taking daily antibiotics for life to prevent infection. Option D, relying only on treatment once symptoms have appeared. Pause here and choose your answer. The answer is B, tetanus toxoid vaccination, a primary course plus boosters. This is the cornerstone of prevention. A primary childhood course, for example, in the pentavalent vaccine, with boosters to maintain immunity, plus wound-based boosting when indicated. It has made tetanus rare where coverage is high. Avoiding soil is impractical. Lifelong antibiotics are inappropriate, and relying on late treatment is far less effective as tetanus has a high mortality. Question 9. A patient attends with a dirty, tetanus-prone wound. The nurse must decide on prophylaxis based on the wound and immunization history. Which approach is correct? Option A, base it on wound type plus vaccine status, toxoid with or without immunoglobulin. Option B, give the same treatment to everyone regardless of history. Option C, never give any prophylaxis for wounds under any circumstances. Option D, only ever clean the wound. Vaccination status is irrelevant. Pause here and choose your answer. The answer is A. Base it on wound type plus vaccine status, toxoid with or without immunoglobulin. Wound prophylaxis is individualized by how tetanus-prone the wound is and by the patient's immunization status. A toxoid booster is given if cover is incomplete or uncertain, and tetanus immunoglobulin is added for high-risk wounds in inadequately immunized patients, plus wound cleaning for all. Where equine antitoxin is used, an ATS sensitivity test is done first. It is not one size fits all, and status does matter. Question 10. A midwife in a rural area wants to prevent neonatal tetanus, which has caused several newborn deaths. Which strategy is most effective? Option A, apply cow dung or ash to the umbilical stump as tradition. Option B, delay all newborn care until the baby becomes unwell. Option C, maternal tetanus immunization plus clean cord care. Option D, cut the cord with any available unsterilized blade. Pause here and choose your answer. The answer is C, maternal tetanus immunization plus clean cord care. Neonatal tetanus is prevented by immunizing the mother with tetanus toxoid in pregnancy, passing protective antibodies to the baby, combined with clean delivery and clean cord care. Clean hands, a clean surface, a clean cord, sterile cutting, and nothing harmful on the stump. Applying dung or ash, delaying care, or using unsterile blades all cause neonatal tetanus. Let's recap tetanus part 2. Management rests on 4 pillars. Clean and debride the wound. Neutralize unbound toxin early with tetanus immunoglobulin. Give antibiotics, metronidazole first line to kill the bacteria, and control spasms with benzodiazepines and magnesium, ventilating if severe. Nurse the patient in a quiet, dark, calm environment and monitor closely in ICU for autonomic instability. Remember that surviving the disease gives no immunity, so the patient must still be vaccinated. Prevention rests on the tetanus toxoid vaccine and boosters, on individualized wound prophylaxis by wound type and vaccine status, and for neonatal tetanus on maternal immunization plus clean cord care. Keep going and remember, we don't pass alone, we pass together.